Lung cancer doesn't usually knock loudly on the door. Most of the time, it whispers. A cough you ignore. Shortness of breath you blame on age. Fatigue you think is just stress. And by the time many people realize something is wrong, the disease has already progressed. Lung cancer is the leading cause of cancer-related deaths worldwide and one of the most common cancers in adults. What makes it so dangerous is that early lung cancer often causes no obvious symptoms at all. But here's the hopeful part. Some people do notice early warning signs, and when lung cancer is caught early, treatment is far more effective and survival rates improve significantly. Today, we're going to talk about the warning signs of lung cancer you should never ignore. Before we begin, remember this. Many of these symptoms can also occur with common, less serious conditions. But if they are new, persistent, or getting worse, they deserve medical attention. 1. A new or persistent cough. Let's start with the most common early sign, a cough that doesn't go away. If you catch a cold or flu, coughing is normal and usually clears up within a week or two. But if you develop a new cough that lasts more than 6 to 8 weeks, especially if you are a smoker or former smoker, this should raise concern. Even more important, pay attention to changes in an existing cough. Is it deeper, harsher, more frequent, producing more mucus than usual? Your body is often the first to signal that something isn't right. Don't ignore it. 2. Coughing up blood, even a small amount. This symptom should never be ignored. Coughing up blood, or even blood-streaked mucus, can be frightening, and for good reason. While infections can sometimes cause this, it can also be an early sign of lung cancer, even if it happens once, even if it's just a small amount. See a doctor immediately. 3. Repeated chest infections. Do you keep getting bronchitis or pneumonia over and over again? Lung tumors can partially block airways, creating an environment where infections develop more easily. If you've noticed frequent respiratory infections, especially in the same area of the lung, it's important to investigate further. 4. Shortness of breath or wheezing. If climbing stairs suddenly leaves you breathless, and it didn't before, pay attention. Shortness of breath or wheezing is often blamed on asthma, allergies, aging, or lack of fitness. But lung cancer can narrow or block airways or cause fluid to build up around the lungs, making breathing more difficult. A new whistling or wheezing sound when you breathe should always be checked, especially if it wasn't there before. 5. Hoarseness or voice changes. Have people told you that your voice sounds different? A lingering hoarse voice that doesn't improve after a cold may be a warning sign. In some cases, lung tumors affect the nerve that controls the vocal cords, leading to persistent hoarseness. If your voice has changed and stayed that way for weeks, don't brush it off. 6. Unexplained weight loss. Losing weight without trying may sound like a blessing, but it's often a red flag. Cancer cells consume a lot of energy, which can cause rapid, unexplained weight loss. If you've lost 10 pounds or more in a short time without changes in diet or activity, it's time to see your doctor. 7. Chest, shoulder, or back pain. Lung cancer doesn't always cause pain early, but when it does, it's often ignored. You may notice chest pain when coughing, laughing, or breathing deeply, pain in the shoulders or upper back, a dull ache that doesn't go away. This pain may occur if the cancer spreads to the chest wall, ribs, lining of the lungs, or nearby lymph nodes. 8. Bone pain, especially at night. If lung cancer spreads to the bones, it can cause deep, aching pain, commonly in the back, hips, or other bones. Bone pain from cancer is often worse at night, worse with movement, persistent and progressive. This is not the typical muscle soreness most people experience. 9. Headaches, fatigue, and facial swelling. Advanced lung cancer can cause a range of other symptoms, including frequent headaches, loss of appetite, swelling of the face or neck, constant fatigue or weakness. These symptoms may occur when cancer spreads or interferes with blood flow and oxygen delivery. Who is most at risk? Smoking remains the largest risk factor for lung cancer. The longer and more heavily a person has smoked, the higher the risk. However, and this is important, lung cancer can also occur in people who have never smoked. Secondhand smoke, environmental toxins, air pollution, and genetic factors also play a role. The good news, if you quit smoking, even after many years, your risk of lung cancer begins to decrease almost immediately and continues to fall over time. Final message. Listen to your body. Lung cancer doesn't always scream. Sometimes it whispers through small, easily dismissed symptoms. If something feels new, unusual, or persistent, trust your instincts. Early detection can save lives. If you found this video helpful, please like and share it. You never know who might need this information. Subscribe to the channel for more trusted health awareness videos. Thank you for watching, take care of your lungs, and we'll see you in the next video.